excited. Our first little pop-up, and it's something I'm very passionate about. It's health. I don't know if you ever sat in my chair while I'm cooking here. I like to talk about that. It's just fun. And I happen to have a brother-in-law that's Dr. Snow. I'm sure a lot of y'all happen to already know him. He's fantastic, and I really believe what he's doing. He's really helping change people's lives. So I just want him to come in and speak to y'all. And any questions you are welcome to ask him. But Philip is going to come up first. We love Philip. He has helped me multiple times on my shoulder and different things, and so he's going to come up and talk a little bit. Later, we do have a few little healthy treats back there, so please go get some. But yes, and don't need anything else to drink. I'm happy to have for you. Yes, here is Mr. Philip Savoy.
All right, thank you, Mindy. So my name is Philip. I've been the myofascial therapist with Dr. Snow for the past 5 years now. And I can tell you, between me and Dr. Snow, there isn't much that we can't treat. And the reason why that is because we approach it from 3 different levels. The skeletal side, the muscular side, and the fascial side. Now, everybody knows the skeletal and muscle side. We've been hearing about that for years. But not enough people know about fascia. So I'm going to try and fix that tonight a little bit. So what is fascia? Fascia is the connective tissue that surrounds your entire body. Think of it almost like another skin suit. It's comprised of collagen, and it's almost a very sticky white web, just that allows your body to move and do everything. It also holds the shape of your muscles and your organs. It keeps it all. It's kind of like the scaffolding for the body. Now, so how is that relevant to y'all? Why am I even talking about it tonight? Well, I discovered that whether you're a soccer mom or a soccer star, a mathlete or an athlete, a hairstylist, office worker, your actions, your posture actually can affect your connective tissue. So let's say, since we're in a hair salon here, the person's working on their, hold their hands up, they're working the person's hair, they're hold it like this. The connective tissue all lines up and says, all right, if we're doing this, we're going to all line up properly so we can hold these shoulders up. Which is great, because that's where it's great for the person doing the work. But you start doing that for a couple of hours, and all those, the connective tissue and muscle starts getting really, really tight, because the body says, oh, we're holding this position for a while, they must really need to be here, so it just tightens up further and further. And again, that's great, because it helps out the stylists when they're doing their work, but when they need to do something else, like turn their head to the side, if you're doing this, and you try to turn your head, it hurts a lot. It's very stiff. The muscles are very restricted. As Lindsay can tell you, yes. But not only just that, but we live in a society, the way that we work and move, we're stuck in a posture for hours and hours. And then we do that day in, day out for weeks, months, and years. So your body then develops a memory of that. So your body says, oh, if I'm going to do this position a lot, I'm going to make it really easy to get into that position. But over time, that creates a lot of restrictions for other things that you may need to do. But we need to address that as soon as possible, because otherwise, you start getting a lot of dehydration in the connective tissue, you start losing blood flow into the area, and that the collagen just hardens up even further. Actually, I would like a volunteer to come up real fast. I want to do something. Anybody, any volunteers? Everybody want to come up?
Go, Miss Amy, go.
Hey, me.
All right, so this right here is going to serve as my connective tissue, the fascia. I just realized this may block off the microphone a little bit, so I'm trying to not do that. So I want you to grab this just as hard as you can. Really grab onto that bundle up really, really tight. Okay? Really, really tight, okay? Yeah. And pull down, really pull down. Okay. So if I were to try to raise my arm up, I really can't. I'm really struggling to get this arm up. Okay, you can bless. Woo, she's strong. Get right here, everybody. All right. So that's exactly what happens with the fascia. I didn't miss it. All right. So that's what happens with the connective tissue. If the fascia is bunched up, it's tight, and it's pulling in a different direction, you're going to lose a lot of that mobility. So like I said before, like if you're a stylist and your arms are up and you're trying to turn your head, you're going to lose a lot of that. So we have to address that basically as soon as possible, because over time, not only will it affect your movement, but it can affect your lymphatic system. All of this stuff throughout here. You ever had like sinuses build up and you feel like you're just not draining properly, right? A lot of times that means because these muscles in the neck and the connective tissue around there are so tight that it's actually blocking the flow of the lymph. If you've ever had chronic inflammation, chronic so low back pain or hip pain, it just feels like it's not going anywhere, you may massage it, you may do something, and it's not helping, it's because this tissue is so tight and so restrictive that the blood flow can't go through properly, and all of the inflammatory agents and anti-inflammatory agents can't get to that area and get out in time. So, a couple of examples for pretty much everybody here that I can kind of really help paint this picture. So let's say your upper neck. Let's say everybody, we have our very forward-leaning posture, maybe computers, working with people, leaning over stuff. Your neck muscles will get super, super tight. These pec muscles in the front will also draw very tight. They'll pull the shoulders forward. And watch as my shoulders go forward, my head comes forward. So as the shoulders come forward, the head comes forward, and all of these neck muscles get super, super tight. You're trying to hold on to everything, trying to keep the head up. This is where people get your headaches, your neck pains, your migraines, all of that stuff, shoulder pains, and over time it's going to create a shoulder issue, and the list just goes on and on. And then finally, let's see your low back. Again, we're constantly leaning forward. You may be stuck in a chair all day leaning forward. You're going to create tension in your low back. It's going to create issues in your hips. And this is where people get piriformis, sciatica. All this kind of stuff happens from just the posture that we subject ourselves to. But of course, it's not just that. This is from a lot of things, from rotator cuff surgery, injuries, again, piriformis syndrome, sciatica, plantar fasciitis, tightness in the IT band. All of that comes from the long-term posture that we put ourselves through, and it changes the connective tissue in the fascia and just create compensatory patterns, and it just creates more and more issues. So whether it's headaches, neck pains, shoulder issues, all of those things, and I guarantee everybody's here has at least had one of those things that I've described, right? Sounds familiar, right? So, yes, everybody's had at least one of these symptoms, and fortunately for you guys, the good news is me and Dr. Snow can fix that for you guys. We've been doing this for a long time. This is our bread and butter. We can do this. Anything you've got, we definitely can help you out. You just need to come by and see us. I'm going to be doing some sessions over there after the talk is over. And then, of course, we'll be doing answering questions, and we'll be able to talk over there. But please come by and just talk to us. Let us know if you've got anything going on. We'd be happy to help you. And Dr. Snow, I believe it's your turn.
Dr. Snow!
The green line on? The green.
All right. You all excited to be here?
Yes!
Give Philip a hand clap. Philip's come a long ways. I don't know if y'all know this, but he doesn't shake as much as he used to when he talks. He's more articulate. It's a good job. So I'm going to give you an origin story this evening. I know a lot of y'all have heard me speak already, but my journey into what we're going to talk about tonight actually started in chiropractic school. And so I had a really awesome experience as a chiropractor. When I was in college, I had an old soccer injury. A friend of mine taught me to go into a chiropractor, and he fixed me and got me off of pain meds and NSAIDs. And I thought that was pretty impressive that a doctor could help get me out of pain. And I've been living off of medication for years, and all he used was his hands. And so that opened the door for me into natural medicine. And so years later, I'm in chiropractic school, and we're in grand rounds. And so grand rounds, you're walking with a huddle of your colleagues, and you have a doctor there, and they're presenting very difficult cases. And so there's x-rays up, they're giving your history, and they're calling on you in front of your peers and asking you very difficult questions. And so during that particular grand round, I get called on. They asked me a question, and I had what I didn't know at the time was my first panic attack. And I don't know if you've ever had a panic attack or if anybody's ever had anxiety issues before, but it's a very scary thing. I didn't know what it was. I didn't know what was going on. All I knew was I had to get out of that building as fast as I could. And so I actually told my friends something is wrong with me, and I left the clinic, basically ran to my car in the parking lot, and I got in my car, put the visors down, took my seat, dropped it backwards, and I was hyperventilating in my car. And so anyways, that opened the door to quite a journey. And this story is really going to paint the picture of what we're going to talk about tonight, because we're talking about inflammation's connection with energy and different health problems. And so I went through a very similar journey like I did with the pain in my leg. And so that was a tibia fracture that eventually brought me into a chiropractor. I walked around for a whole year with a fractured bone, trying to play sports. The tibia would not union, come back together. So I had to have a second surgery. They went in, they did a bone graft, they broke my fibula, took that bone, packed it in around the fracture site, stuck another rod in there, and it finally came back together. But the problem is my leg was never the same after that, and I would have episodes of pain. And I went to many different doctors, and nobody could help me, but what they could give me was medication, which is what a lot of people are offered nowadays. It's just medicine for their problems. And so the panic attack starts. It wasn't the first time. After that point, things got a little bit worse for me. I started dealing with chronic anxiety every day. My head started to become very foggy. I didn't have energy. I was dealing with a lot of fearful thoughts. But here I am getting ready to graduate chiropractic school so I can go out in the world and help people with chiropractic. But now I'm sick before I graduate. So I go to a medical doctor at our integrative clinic, Moody Health Center, and he looks at me. He's like, your blood pressure's up a little bit. He said, I don't know why you have anxiety, but I think you should try some blood pressure medicine. And that was a tough sell for me, because here we are in chiropractic school learning about natural medicine, and now I'm in a position to have to take a medication, which I didn't want to have to do, and it didn't make sense to me to get on a medication when I really didn't have high blood pressure. And so I went to another doctor, and he told me maybe it's your wisdom tooth, and so I got my wisdom tooth pulled out. That helped maybe just a little bit. So now I'm stuck. I don't know what's going on. I talked to several doctors. I decided I didn't want to get on medication. And I decided, hey, let me go talk to my pastor. Let me see if this is something spiritual. And so I have a meeting with my pastor, and I talked to him, and he's like, Eric, this is a health problem. This is not something spiritual. You need to go see this guy that I went to. And so I got introduced to my first holistic doctor, who became my mentor later. And so I go to his office. He did some really unique testing on me, and I found out that I had adrenal fatigue, I had a gluten allergy, in candida and different vitamin deficiencies. And so I got on this doctor's program, Dr. Stuart White, and it was amazing to see this chronic, very tough condition that was controlling my life was actually fixed through making dietary changes and using natural medicine. And so jumping from there, we have a handout for y'all to follow here. But this is what I've seen. So I've been doing this for right at 20 years now. And you name the condition that comes into our office. We see autoimmune disease, we see hormone imbalance, we see panic attacks, anxiety, infertility, chronic pain, thyroid problems, diabetes, the list goes on and on. And we have been able to support people through their different health conditions, all by chiropractic, lifestyle changes, and correcting nutritional deficiencies and detoxification. So where we're at today in healthcare, even globally, but definitely here in America, is what the real problem is. We don't have a deficiency of medication. What's going on is our food supply got changed years ago when they started to process foods in the late 18th century and early 19th century. And they were trying to process food so that they could make shelf life foods last longer, but we had no idea that we were going to create an epidemic of disease. And so what's going on today is we have people that are actually in nutritional deficiency, and we are feeding people poisons and medications trying to correct the reaction of starvation. And so we really have an epidemic of nutritional deficiency disorder. And so you look on your paper here, the big question is there poison in our food? And the question is, I think Michelle would answer it correctly, but would you eat something if you know it was poison? Would you do that knowingly? Probably not. So let's look at what poison is. The poison is a toxic substance that causes illness, injury, or death taken into the body. A poison has a negative influence. It's something that causes destruction. And then a poison can actually pollute water, land, and severely can be a harmful substance. And so what's happened is we had this merger of food and business, and it's become a very unhealthy alliance. And what started off as innovation to try and create food that would last longer, last at the grocery store longer, last in our houses and pantries longer, has actually caused an epidemic of toxicity. And if you go to the grocery store, what you see is most people are buying boxed foods, canned foods, things that are full of preservatives and dyes, and they don't realize that those foods are unnatural and that they're toxic, and they cause deficiency and they cause inflammation in the body. So one of the biggest problems that we have in the American diet is something called refined flour. And so refined flour is something that we call gluten. And what happened was with grains, to preserve it, what they learned is for us to be able to have bread or these different grains and grain products to be able to last, they had to take the germ out of the product. Because when they would process it and leave the germ in it, germ is, we term as fat. And so that germ does not last very long. And so they could not have a refined wheat product with the germ in it. So they pulled it out. And the problem with that is all the nutrition is actually in the germ. All you get when you eat refined flour and breads is you get carbohydrates. Carbohydrates, all they are is a bunch of sugar attached together. And that's what the big epidemic is in America, is metabolic disorder. And so we're getting too many refined carbohydrates, too many flours, too much wheat products, and then we're actually not getting the right nutrition. And what's interesting is we use wheat germ at the office. All this is the germ oil, the fat that's naturally found in the whole wheat product, and they've cold processed it and put it into a pearl. Now, this is interesting because this one product here has natural vitamin E complex in it. It has a full complex of B vitamins, and then it also has something called octacosanol in it, which increases the oxygenation in your body. So what could somebody use wheat germ oil for? We have used this to help women that have infertility problems and have had spontaneous abortion. This is actually an anti-abortive supplement. It increases the steroids and the hormones and supports progesterone production in the body. This is used for athletes so that they can have more stamina and energy. And this is also used for kids that have attention issues because it feeds the brain so well with the oxygen and the B vitamins and supports the adrenal system. And so if you can imagine years ago when we ate foods more local, and then now we strip all the nutrition out, you can see why we have so many problems. Now, the thing with the gluten protein is it is actually one of the most harmful substances that we have created through manufacturing foods. And there's a couple different problems with the gluten protein. We have hybridized so many foods for production and for volume in our diet. And the gluten protein has been so hybridized that it's a very large protein and it's very hard to break down. And when you take that protein into your gut, it actually irritates your gut. And it can lead to something called leaky gut syndrome, gut dysbiosis, and even autoimmune disease if you overconsume gluten. And we're now at an epidemic where people actually have what's called a gluten allergy, and they don't know it. And what happens when you take foods in like gluten, and your body has developed an allergy to it, every time you eat that particular food, you have an immune response to that food. That food becomes an antigen, just like if you got exposed to COVID, a virus, or the flu. And so when your body gets an immune response to your food, it creates massive inflammation, a systemic inflammation in the body. And so just from eating a sandwich, or eating a bowl of pasta, or eating something fried, you now cause an immune response and you exhaust your body because your body thinks that you're under attack. And so it has to reroute hormones, it has to reroute nutrition to actually fight that inflammatory load. And then what happens is over time, when you unknowingly don't know that you have this sensitivity, it will exhaust your system and deplete your system. So if you turn on the second page, turn that newsletter over, I have a couple of points to explain what a gluten protein can do. So if you have a gluten issue, that gluten is very hard to digest. So you have to start to pay attention when you eat foods, how you feel after you eat that food. So my family probably gets a little annoyed with me because I'm quite a bit different than, say, maybe a medical doctor might be as far as the questions they ask. So if somebody in my family doesn't feel well, my first question is, what did you eat yesterday? So how many people have thought about that? I don't feel well, what did I eat today? What did I eat yesterday? And the reason why that is so critically important is if you study all the ancient cultures that did not eat processed foods, you will see that they had very little sickness and disease in their culture. And they talk about these people like the Huns are a group of people that have been real popular. But some of these civilizations they study, they were isolated in some geographic area, like in the mountains or so forth. And so they never adulterated their food. They ate whole foods. Their food was coming from the soil, did not have glyphosate on it, chemicals and toxins. It wasn't hybridized, and they weren't sick. There's a particular guy, he studied all this out, and it's really cool. He has, it's Dr. Price. He has pictures of these cultures that he went and studied. And before they introduced grains and processed foods and soda pop and sugars like the Aborigines in Australia, they didn't have disease. They didn't even have any dental caries. Their teeth were almost straight. They were white. They were strong. And what happened is when these particular cultures got introduced, processed foods got introduced into their culture, they started to get sick, just like Americans do. But when you're sick, you really need to ask a question, or you have symptoms, you have anxiety, you feel tired, you need to ask yourself, what did I eat? And you need to learn how to understand what food can do for you and how food can harm you. But simple things of this intolerance to food, specifically talking to gluten, is it can make you feel bloated. So if you've ever eaten bread or grains and you feel bloated, you might have a sensitivity to it. If you eat a particular food and all of a sudden you feel anxious, then you might have an allergy to that particular food.
Coffee does that to me.
What's that?
Coffee does that to me.
Yeah, so coffee is very stimulating. You might not necessarily have an allergy to it, but it could be the amount of caffeine that's in that. But does anybody here know what gluten is specifically? It's basically found in grains. It's found in breads and cereals and refined products. But the deal is it can lead to autoimmune imbalances. And we have treated a lot of rheumatoid arthritis, psoriatic arthritis, Hashimoto's, which is also an autoimmune. And what I'm starting to see after 2 decades of practice is almost everybody has some level of this autoimmune progression in their body. And And so just because you might not test on a blood test, if you do a specific antibody test for rheumatoid or an ANA or a titer or some of the thyroid antibodies, you still can be going into that progression. And what the problem is these foods that we're eating, these processed foods, they actually inflame the gut lining. And your gut lining, if you look at it, it's almost like bricks and mortar. You have what's called your tight junctions, and these specialized cells that make that intestinal tract and that lumen, they have what's called a tight junction where they come together. And when you eat these foods, specifically gluten is the biggest player, it causes that mortar, those tight junctions, to loosen. And that's what allows for the contents of your guts to actually go into your bloodstream. And that sets you up for this progression of chronic inflammation. And if it gets out of control, you will go into autoimmune disease. And most thyroid problems that I'm starting to see, most of them, I'm going to say as high as 90% are connected to this autoimmune progression and what we call leaky gut syndrome. And so these foods will cause your gut to leak, and gluten is probably the biggest player in that. So what happens when a person who's sensitive eats gluten? We talked about that, but it causes the inflammation, and then that actual gluten protein will slip through your intestinal tract and go into your bloodstream and become an antigen, and then that creates an autoimmune response or an antibody response to that. Moving down the line here, do you suffer from these common symptoms? So common symptoms of food sensitivities are going to be bloating and fatigue, especially after meals. Is anybody suffering from that? Bloating and fatigue? Or nobody wants to talk about it? I forget some of these questions, like anybody constipated, nobody wants to answer me. No worries about it. Headaches and mental fog and forgetfulness. If you eat a food and you start to notice like your brain is really sluggish, you had some type of inflammatory response to that. Usually it's a food sensitivity. Sometimes it can just be you just had way too much carbohydrate and sugar. And so you're getting a big blood sugar spike, and then you're going into a temporary state of hypoglycemia, which is low blood sugar, and that'll affect your energy level. Now this is a big one that people don't connect to their pain, is the foods that they eat. But that is a telltale sign that you have gut dysbiosis, leaky gut syndrome, or you have a food sensitivity, is joint pain and stiffness. Me and Philip have noticed that a lot. We'll get a person in there, and they want to do the full program. They want the nutrition, the functional medicine, they want the soft tissue and the body work. And we'll start working on them. Philip does all the advanced soft tissue work, and I do the chiropractic work. But what's interesting is we'll start to work on them, and they're sometimes as stiff as a board. It's like somebody poured concrete between the shoulder blades, with the low back's very tight. And we're working on them. They're feeling a bit better, but they're still pretty tight. But then they'll make a diet change. When we get to that point in the program, they start to pull the gluten out of their diet and the sugars out of their diet, and you will see the musculoskeletal problems just start to almost magically get better. So a lot of the stiffness and tightness that people are dealing with, yeah, it's soft tissue, yeah, it's mechanical, but a lot of it's systemic inflammation. And where is it coming from? Most of it is coming from your diet. It's coming from the foods that you put into your body. We're going to get into a little bit of physiology here, but the big thing that I wanted to challenge y'all with, I want y'all to be able to walk away with something tonight. Has anybody done a gluten challenge before? So the gluten challenge is basically getting off of all wheat products and all flour for 3 weeks. And what we see, go ahead.
Just 3 weeks?
Yeah, 3 weeks. And so what we've seen when it comes to food allergies and autoimmune problems, these inflammatory issues from the foods that we're eating, if you get off of that food for at least 3 weeks, you can definitely see, it's called a food allergy elimination program, you can see what that food's been doing to your body. And gluten is the main culprit to a lot of these health conditions. And so we've seen some really impressive changes just in 3 weeks when people get off of gluten. So raise your hand again if you've ever gone gluten-free.
That's
Anybody?
rice.
Does rice have gluten?
It has a certain type of gluten, but I'm specifically talking about flour. Yeah, wheat products. That would kind of be a bit of a rabbit trail, but gluten is can be confusing. When they say gluten-free, they're actually talking about the gluten from wheat. But all grains have some type of different gluten in them. And we do take patients through grain-free diets as well. Yeah, so that's my challenge for you if you're suffering from weight loss resistance, you're suffering from any type of like tension, tightness, pain, digestive disorders, any type of like emotional health issues like brain fatigue, anxiety, panic attacks. Getting off of gluten can be a big game changer. And we're about to take a dive into that. But my personal story was when I went to the holistic doctor, he told me that I had a gluten allergy. And it's very overwhelming when we talk to patients about doing different foods, taking them out of their diet. I've had people actually cry, over taking certain foods out because they can't understand, well, how could I ever like have a diet where I don't eat flour, or I don't eat gluten products, or they love bread, or they love these different things, and it can be really tough. And so he told me, he said, hey man, I really need you to get off of gluten. And it was a challenge. I got off of it, and I started to feel better, and so my first thought was, hey, I'm feeling better, I should be able to have some gluten again. And so I'd eat the gluten, and then the inflammation would start to come back, and I'd get back off of it. And so I did a real advanced blood test where they actually test you for the antibodies that you have for food, which is a very powerful test to do. And there was other food sensitivities that I had, but my primary food sensitivity was gluten. And so now I had a test, a real good blood test that told me, hey, you have a gluten problem. And then later I actually did a genetic test and found that I had a lot of patterns for celiac disease, which is a genetic inability to basically break gluten down. And I finally convinced myself, hey, I have to get off of gluten. So I got off of gluten, but then a new challenge came. I didn't know what all had gluten in it. And so you can ask Katie, we would go like to a restaurant and I would eat thinking that, hey, this is a gluten-free, this is a salad, it had meatballs on it. But then I would feel, hey, I'm tired, I have that feeling again. And Katie would sometimes call the restaurant and say, hey, was there gluten in the meatball salad? So this actually happened at Tony's. And they're like, oh yeah, we have breadcrumbs in the meatballs. And so I had become very highly sensitive to gluten. But after several months, I figured out what all had gluten in it. I had to get really specific, ask specific questions with waitresses and the waiters and so forth. But as I got off of the gluten and stayed off of it, and I actually went a full 16 years on a gluten-free diet, it was a game changer for me. Anxiety that I had went away, my energy came back, inflammation got better, and just my mental clarity was better. And you can ask Katie, it was a pretty big change. She was like, oh, I got my husband back. But it can be that big of a deal. But this might sound like another diet challenge, but it really isn't. We've seen people like change their lives getting off of gluten. We even had people that have had seizures before that people couldn't figure out, and they got off the gluten and some of the other food allergies, and the seizures went away. I've seen kids that had severe social anxiety disorder get off of gluten, and that started to get better and go away. And we've seen a lot of thyroid cases get extremely better by getting off of gluten because of the amount of inflammation that it causes. So I'm going to read a quote that I really like. It kind of supports what I was referring to earlier. So a gentleman named Dr. Rowley is one of our nutritional pioneers in America. He says, disease does not exist in primitive races eating natural foods. We know also that the diseases of civilized man, cancer, diabetes, hardening of arteries, tooth decay, and many others are practically non-existent among those living on natural foods. And so that's what I want you to go home with tonight, is to realize, hey, I can change my life by changing what I'm putting in my mouth. And it's so interesting to me with all the different conditions that we've put into remission, help people overcome through using nutrition, chiropractic, and lifestyle changes. when you talk to these patients, and a lot of these patients have been to like 4 to 5 doctors and they're suffering on they're on lots of medications. Not one of those doctors has ever sent them home with a food record. Not one doctor's ever asked them, what are you eating? They just give them a medication. And that's the problem that we have right now in healthcare, is we're treating nutritional problems with medication. And it should be our first defense against sickness and disease. Okay, so I'm about to close this up, but I wanted to give you some biochemistry. I'm going to ask you some questions and put some stuff on the board here. So this is going to drive home the connection of inflammation and energy. You have good fingernails. So does anybody know what cholesterol is? Is cholesterol good or bad?
Good.
Yeah, so that's a trick question. Cholesterol is not bad in itself, but you can have too much cholesterol, and it can be bad. But the real answer is, why is your body producing more cholesterol? And it's usually producing more cholesterol because it's trying to save you, because you have so much inflammation. And so what do? We see cholesterol high, we give somebody a statin and bring it down. We think we help them, but more than likely we actually hurt them and cripple them and cause deficiencies and make their liver sick. So cholesterol is a very important substance. It is basically a waxy fat. And does anybody have a guess of what you need cholesterol for? What would you use cholesterol for in the body? So cholesterol is actually used to make cell membranes. So every cell in your body, every tissue and organ needs cholesterol to make that actual cellular membrane. So you can kind of think of it like the peel on an orange. If that peel was the membrane, well, you need cholesterol to make that peel. So you wouldn't even have a membrane in your cell if you didn't have cholesterol. So do you think cholesterol is bad or good? Good. Is it necessary? Yes. It's very necessary. Now, when you get this idea, it's going to open your minds up a lot of really cool understanding of how nutrition works. Guess what you need cholesterol for as well? Hormones. All your hormones are made from cholesterol. Almost every single hormone is made from cholesterol. So the body takes cholesterol and turns it into pregnenolone. So pregnenolone is what you would call mother hormone. Has anybody heard of a stem cell before? You can they do cool things with stem cells and you can turn it into any other cell. Well, I like to think of pregnenolone as a mother hormone that can be turned into pretty much any other hormone. Your adrenal glands, does anybody know what your adrenal glands are?
Sit on top of your kidneys.
Yeah.
They stabilize your mood.
Yeah, that's pretty good, Miss Angie. So your adrenal glands, if you look at the word adrenal, it says renal. Renal refers to kidneys, and so adrenal glands, about the size of walnuts, they sit on top of your kidneys, and they basically make lots of hormones. Have you ever heard of cortisol? That's going to be generated basically by the adrenal glands. You ever heard of adrenaline? What does adrenaline do?
Make you, once you run from a bear.
Yeah, gives you energy, right?
Yeah.
So you can move and do sports and have bursts of energy. So they make many different glucocorticoids, different hormones. But one of the main ones that pregnenolone gets turned into is DHEA. So basically the only thing that can concentrate pregnenolone in the body is your adrenal glands. And so your adrenal glands are basically known as your fight or flight glands. And so if a bear came in this room right now, you're either going to have to fight the bear or you're going to have to run from the bear. So your adrenal glands are going to release cortisol and adrenaline basically. So you have the energy to fight that. But what would you call that response? What's that response you're having to the bear? Just broke into Lindsay's salon. What would you call that? Would you be stressed? Yeah, it's a stress hormone. Those glands handle that stress. And so pregnenolone gets concentrated by the adrenal glands, gets turned to DHEA. And what does DHEA get turned into? It can get turned into any of your sex hormones. So they get turned into progesterone, estrogen, testosterone. And this is very important for ladies. And I'm going to connect the dots real quick and then we'll be finished here. So DHEA gets turned to sex hormones. DHEA is basically made by the adrenal glands primarily. And so what is going on with most people is something called the pregnenolone steal. That says cortisol, by the way. So we need cholesterol in the body to make what? What two things? Cellular cell membranes, and then to make what? Hormones. The body, the adrenal glands take cholesterol, we bring it to pregnenolone, concentrated DHEA, and what's happening, the connection between inflammation and energy is when the body gets overwhelmed and chronically stressed out. So stress is either going to be emotional perception or it's actually going to be infection or inflammation in the body. When that happens chronically, like what would happen if you had a sensitivity or an allergy to gluten, the body's going to perceive stress. And if that's happening over and over and over again, instead of this pregnenolone going down this nice pathway here of DHEA to help produce sex hormones, help you produce energy, the pregnenolone gets stolen by the body because of a fight or flight understanding, and it gets turned into cortisol. So if this is getting turned into cortisol all the time, it's going to deplete your adrenal glands, and that's going to cause you to not have energy and not have hormones. And so one of the biggest things that we're seeing today is a lot of people have hormone imbalance. We deal with a lot of females, and basically the way God has the body set up is we have our glands. I'm going to just use the female example, but you have your ovaries. Your ovaries make your sex hormones. And then when your ovaries either get cut out or they're retired through menopause, guess who's supposed to produce those sex hormones for you? Your adrenal glands. But if your adrenal glands are under chronic inflammation from the bad foods that we eat and the stressful environment that you're in, they can't make the sex hormones for you. Because the body perceives that you're having to fight something, and so these hormones that would make you feel good, recover, have a libido, they all get turned into cortisol. And cortisol is a catabolic hormone. And so catabolic means that it actually breaks your body down. And so this is the progression of chronic stress, chronic inflammation, energy fatigue, depletion of sex hormones, and then even weight gain and insulin resistance is this whole concept right here. And so the big take home from this here, or the moral of the story, is that you have to have proper nutritional support, and then you have to have proper lifestyle modification, and you have to have the appropriate diet to fight this. And so it's important that we come to the conclusion that what we put in our mouth makes all the difference of how our body feels, and if we're healthy or if we're sick. It all comes back to the food that we eat. Excellent. Okay, any questions on that? You seem inquisitive.
My sister has a lot of these issues. I wanted her to come today, but she couldn't come because no one could babysit her kids. But yeah, answers a lot. She eats a lot of fast stuff. So
I gotcha.
yeah, I'm gonna try to tell her to come to you because she had what is it called, hypothyroid, that became Graves' disease.
Right.
So now her eyes are like,
Yeah, they start to
bulge
actually,
out.
it's called exophthalmos, that actually starts to protrude out of the
Yeah, so that's what's going on right now with her. So I want her to come, but I'll let her know. It's
Excellent.
very interesting.
So is anybody going to take the gluten challenge? Sure.
If somebody does it with me. Also, she can watch it on Facebook. They're doing Facebook, so maybe
Oh, live?
play.
Yeah.
I thought I remember.
Okay, so moving from there, that was the big thing I wanted to teach, was to try and show y'all that the foods that we eat have a bigger impact on our body than we realize. And it's the processing of food that set us up for where we are with the epidemic of sickness and disease that we have today. And this chronic stress, chronic inflammation, reroutes very important hormones that will be used to make us have vitality, libido, and energy, and it pushes us to fight the fire of inflammation. And that causes a drain and efficiency of function on our glands. And that's why we don't feel like we used to feel. And the correction of that is going to be to get the proper micronutrient support and to change the diet. And that's how we start the progression back into better health. So moving forward from there, I'm just going to cover just a couple basic things here. But at our office, so we run a chiropractic and nutrition office. We focus on chiropractic, lifestyle modification, and nutrition. We take a holistic approach. And what that means is we just recognize that the body works together as a full system. And so you'll see that people come in and, they're like fatigued and tired. So a common thing would be, hey, let me give you, some Adderall for that, or let me give you some type of stimulant, and you get a prescription. And people aren't asking enough questions, well, why are you sick and tired? And so we look at, we created a holistic exam, and we have something that's called the 4 Essentials of Health. And so we want to look at your form, and so that's where soft tissue and chiropractic, having a good healthy physical frame come in. And what's real interesting with the brain, speaking of form and actually tying it together back to this inflammation and back to energy, your cerebellum, most of the information going to your brain through that afferent nerve system, which means input in, is actually just to keep you balanced. And so the more out of balance you are, which is what Philip was talking about, soft tissue tension, muscle issues, joints being out of alignment, affecting and irritating nerve roots, your brain has to work even harder, and that causes an extra load on the brain and keeps you more in what's called the fight or flight response, which is that sympathetic mode. And when your gas level stays down all the time, you burn your nutrition and you burn your energy out, and you deplete your hormones and cause your glands to be fatigued. So chiropractic and soft tissue work is very important so you can move better, but it's also important so that your nervous system can express itself and work better, and so that you can get your body out of fight or flight response. When you get an adjustment or you have good effective soft tissue work, most people come out of fight or flight, which means pushing you away from the pregnenolone steel and back more into balance. It's almost instantly you go into parasympathetic state, which is a rest and digest state. But we look at your form, and then we also teach on fundamentals. A lot of people don't realize that we are in harmony with our environment. Our nervous system and endocrine system is dependent on light from the sun. And they've done a decent job in here, but we get exposed to all this different artificial light. And different
Are lights low and out?
Yeah, that's why they have the windows up and lights off most of the time. I was gonna go using my phone, but like for example, the light that's coming out of your phone, it's a different frequency. It's almost the same frequency as the noonday sun. And so if it's 9 o'clock at night, you're trying to go to bed, and you're looking at your phone, well, those signals or that frequency coming from your phone is telling your endocrine system that it's noon versus nighttime. And what does that do? That causes your body to respond like it's at the beginning of the day. So you'll get a cortisol response to that. And so you have to understand proper rhythm. We teach about grounding and how you need electrons from the earth to recharge your cells, improve circulation and pH balance. Oxygen is very important. And then we take a functional approach. And so function has to do with looking at if you're in optimal ranges for the function of your body. So you can have what's called depletion of different blood markers. You could be in a pathological state, or you could just not be in the optimal state. And so instead of just focusing on disease processes, when a patient comes in, our concept is if we do a good job and we focus on keeping you in the optimal range, we'll never have to worry about you being in the disease state. So instead of managing disease, we promote health. And if we continue to promote health, then we don't ever have to manage disease. And that's the concept with that. And then fuel, that's basically what we talked about today. Our diet, because it's so processed, we do so much caffeine and sugars and stimulants, and we're going so fast, we have major deficiencies. And our food supply does not have the micro density or nutritional density that it used to have in it. And we eat commercial foods that are full of toxins and glyphosate, different contamination of herbicides and heavy metals. And so we are at a point now that we have to supplement to get the nutrients that we need. And so many people are deficient. People don't drink water. I had one lady that came in, she had been under pain management for chronic pain. It wasn't working anymore, the shots weren't working anymore. I did her first food record, she brought her food record back. She didn't drink any water. All she drank was soda pop. And so we got her off of the soda pop, got her to drink water, and her pain was cut by 50% in just a couple weeks. So there's a lot of basic things that people never get asked. They just get prescribed a medication. And so we're gonna look at that lifestyle and all those different things when you come into the office. And Katie, did you wanna go over the superhuman? Or you want me to do that?
No, we can check.
Okay. Yeah, so we also have a really cool technology. It's called the Superhuman Protocol. And basically, it's using those main elements that I was talking about here with the fundamentals. And step one with this is we basically recreate what we're supposed to be getting from the Earth. And when they've studied it out, the Earth has lost quite a bit of its magnetism. And there's a concept that when you actually step barefoot on the Earth, you soak up negative electrons through your feet, or if you lay your body down on the ground. And when those negative electrons come to the body, they recharge the cells. And so when we get deficient in negative electrons, one of the major things that happens is our red blood cells actually stick together. And your red blood cells need all that surface area for nutrition and oxygen attachment. So when they clump together, you don't get that O2 and you don't get that nutrition. And so then your body suffers from that, because those red blood cells can't carry the O2 and the nutrients to the body and the tissues. And so we have what's called a pulse electric magnetic field. It's PMF technology. And it's actually a mat that you lie on, and when you lie on that mat, it recharges your body with these negative electrons, and it pulls you out of that fight or flight state and brings you into that parasympathetic state. And so now your vessels, instead of being constricted, they open up and relax, and it helps to realkalinize your body. And then we bring you to step two, which is called EWOD, or exercise with oxygen. And we have a custom mask that you wear. And we have this bag, it's full of oxygen and 2 oxygen condensers. And you put the mask on, and now you breathe in concentrated oxygen in your body. So right now, everybody in this room is breathing somewhere around, I think it should be about like 20-21% O2 in the room. But when you're on EWOT, you're breathing 92% oxygen. And so oxygen helps kill infection. Oxygen is necessary for the cells to basically have energy. And so we load your body with oxygen, which improves the microcirculation, helps enhance repair to damaged tissue. And then we go to step 3, which is photobiomodulation, which is a very high-intense form of red light therapy. But we have a bed that you lay in, and that bed has 45,000 LEDs in it, laser LEDs. And that laser light comes into your body and comes into your cells and gets rid of inflammation. It improves cellular metabolism, and causes that cell to actually work a lot faster, and it gets rid of pain and gets rid of inflammation. And it's real interesting because when that red light comes into the cell, it kicks out the free radicals in the cell that cause cell damage. And one free radical that comes out is called nitric oxide, and it hits the cell and causes the vessels to dilate. And so that opens up your circulation. So when you have like chronic inflamed areas, like Philip was talking about, you can't get the inflammation out, and you can't get the anti-inflammatory chemicals there, and the O2 and the nutrition. And so that'll actually cause that area to dilate and open up, so we can get the bad stuff in and the good stuff in. And we've seen some really amazing things with that, with this program. People with better energy. I actually had a lady we've been working with. She had autoimmune issues with her gut. She's in full remission now through the nutrition and getting on the superhuman protocol. I didn't bring it, but we have a cool picture. It's actually my mom, but she was suffering from post-traumatic herpetic neuralgia, and she had this scar on her back. When it broke out, it looked like somebody poured acid on her back. And so she was just recovering from that, and she got into the superhuman protocol, and that completely disappeared. So it's really neat, but it's a way to accelerate healing. Even for athletes, we had another patient. He was trying to shave time off of his mile, and he actually said that he shaved a full minute off of his mile. That's kind of equivalent to what Lance Armstrong and them were doing illegally by blood doping. You're basically doping the blood with oxygen, but it's in a safe, ethical way that we do that. So yeah, we have some really cool things. We've helped a lot of people, but thanks for coming tonight. Appreciate your time. Do y'all have any specific questions?
Should I keep my yellow light all day long on all day long?